Hey, it's Caden. Today is June 7th, 2011, and I just had my chest surgery revision um, with Dr. Steinwald at Lake Forest Plastic Surgery. He did the first one, and you can look at my other videos to see what he was supposed to change, but there was extra kind of up here, and then definitely on the right side. So I thought he was going to do liposuction, but I think he just kind of cauterized it out and burned it out. It was an awake procedure, and they did kind of put me out a little, but not much, and I really knew what was going on the whole time, and some of it was painful, like when he was trying to do the scar tissue stuff. It hurt a lot, but it's over, so that's good. So, I don't know what it looked like. Same, you can't really see anything, so when they fix it, we'll be able to see what it looks like. I'm really out of it, so I don't know what I'm saying. But for the procedure, for those of you wondering, I went into the hospital. It was in, what section was I in? Not like an urgent. I don't remember what.
It was minor surgery.
Oh yeah, minor surgery area.
Yeah.
So I filled out some paperwork, and then they took me back and just gave me a gown, and I got to leave shorts on and everything, and did IV and signed lots of papers, and then I relaxed for a while, and then wheeled me over to a different room, and I walked to the little table chair thing and sat, and they took pictures and drew on me, figured out what they were going to do, and then they gave me something, I don't remember what it was, and it kind of made the wallpaper look like it was going up and down. But that didn't last long, and it kind of went away, so I don't think it was supposed to. So that would have been nice if it didn't, because a lot of people say with the drugs that I was given that you don't remember much, but sometimes it doesn't work for certain people, so you remember everything, and I think that's me. But it was fine. So, I was talking to them most of the time until it started to get really painful, and then I started crying for some reason and I couldn't stop. I think it's because I was really tired and hungry and it was painful. But it wasn't all painful, it was just really where the scar tissue stuff was. You can't numb it up, so that's where it's painful. So they kept having to tell me to breathe because I would hold my breath. And then after they're done, they put bandages, like some gauze, underneath here and taped it, and then wrapped me, and I'll keep this on and go to my checkup in the morning, and he can look at it, and then I have to keep it wrapped for a couple weeks. I think he'll go over that again. I was kind of out of it and couldn't stop crying, so I didn't ask him too many questions. I figure I'll ask him tomorrow. What else? And then I just sat in the recovery room for a half an hour, and they're all really nice, and you're excused. And they're super nice, and they made me cry too because they were asking about transition and saying sweet things about it. And then one nurse gave me a wet washcloth to put over my eyes, and that helped. Then I was better. Then I went to Walgreens to fill my prescriptions and came to the hotel and ate a peanut butter jelly sandwich and took my medicine, painkiller and antibiotic. So I think that's what happened. Yeah, all went smoothly. It definitely does hurt. I don't know that I can compare it to last time, but it probably hurts about the same, maybe a little less. It's mostly on each side, so I'm just trying not to move around too much. And it'll be interesting to see what it looks like. Of course, it'll take a while for the swelling to go down and everything, but what else to say? Oh, I just had to pay the hospital room cost, which is $285, and since there was a revision, he just took care of everything else. And he was mentioning that on my left side I may need another revision, but we'll see, because he didn't even want to fix that part, but I sort of made him. Anything else to say?
I don't know. He did come by and talk to me, like afterwards. He said it wasn't ideal and that he wants you to come back to fix your left side a little bit, maybe.
So
Do some
maybe
lipo.
fix it.
Yeah.
Okay, but I'm gonna cut this video short because I just took my pain pills and now I'm getting nauseous, and I'm gonna lay down. So I'll talk to you guys later. Bye.